About 700,000 Americans suffer a stroke each year. That's one stroke every 45 seconds.
A stroke is a brain attack that occurs when there's interruption in the cerebral blood supply, resulting in the death of cells and some brain damage. When cells die during a stroke, skills controlled by that area of the brain are lost. The ability to move, feel, speak, or remember can be affected. How a stroke affects a person depends on what part of the brain is afflicted and how much damage results. Ischemic strokes account for about 83% of cases. They occur when clots form within the arteries that supply blood to the head. The blockage of blood results in insufficient oxygen getting to that part of the brain. Ischemic strokes can be divided into two subtypes, embolic and thrombotic. An embolic stroke occurs when a blood clot forms elsewhere in the body and a portion of the clot breaks off, traveling to the blood vessels of the brain. The clot continues its journey until it reaches vessels too small to let it pass. At this point, the clot gets lodged, blocking the blood vessel and causing an embolic stroke. Say the words Richard Nixon and embolic stroke is not what comes to mind. We're more likely to think of Vietnam and Watergate. But Nixon did have a deadly embolic stroke, which occurred when a clot in his heart traveled to his brain. The other type of ischemic stroke, a thrombotic stroke, can also be deadly. In this stroke, blood flow is halted due to a local blood clot known as a thrombus, which develops in an artery supplying blood to the brain. Ischemic strokes are the most common type, but hemorrhagic strokes, which make up to 17% of cases, are often more dangerous. A hemorrhagic stroke occurs when a blood vessel ruptures and bleeds into the brain, compressing the brain tissue. Hemorrhagic strokes can be intracerebral, which is more common, or subarachnoid. In intracerebral hemorrhage, bleeding occurs in the vessels in the brain itself. High blood pressure is the main cause of this type of hemorrhage. If asked to recall Franklin Delano Roosevelt, you're not likely to think of intracerebral hemorrhages. But like Nixon, Roosevelt was a stroke sufferer. In fact, a brain hemorrhage led to his death in 1945. The other kind of bleed is a subarachnoid hemorrhage, which occurs when a ballooning of a weakened blood vessel or arterial aneurysm bursts. Blood then spills into the protective spinal fluid around the brain, causing it to be surrounded by this contaminated fluid. If the blood goes into the brain, or if the blood vessels spasm, it can cause a stroke. A stroke is a brain attack. No matter what type of stroke a patient has, it is important to seek medical assistance immediately, as lifetime disability or death can result. A stroke occurs when there is an interruption of blood flow to the brain. This causes the death of brain cells and results in brain damage. In America, 700,000 strokes occur annually. The symptoms of a stroke depend on the type of stroke and what area of the brain is affected. As early as 400 BC, the Greek philosopher Hippocrates described the stroke phenomena of sudden paralysis. He uses the term apoplexy from the Greek word meaning struck down with violence. Hippocrates had the right idea. One of the most common signs of a stroke is sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. People who are having a stroke can also experience trouble moving due to dizziness, loss of balance, or loss of coordination. Stroke victims may experience trouble speaking or understanding. Sudden confusion is also common. Other possible indicators of a stroke include sudden difficulty seeing and a sudden severe headache of unknown cause. Experiencing any of these symptoms may be an indication of a stroke. However, these signs can also point to a transient ischemic attack or a TIA. TIAs are mini strokes, being like a regular ischemic or blood clot stroke. A blood vessel to the brain becomes blocked or leaks, halting the flow of oxygen and nutrients. The difference between TIAs and full-blown strokes, however, is that TIAs are reversible through normal body repair mechanisms. Even though TIAs disappear on their own, they are an indicator that a major stroke could occur. It is important to receive immediate treatment for a TIA, because more than a third of people with this condition have a full-blown stroke soon after. If you think someone around you may be having a stroke, act F-A-S-T or fast and do this mini test. Face. Ask the person to smile and note if one side of their face droops. Arms. Ask the person to raise both arms and see if either arm drifts downward. Speech. Ask the person to repeat a sentence and listen carefully to the words. Are they slurred? Are they correct? Time. Any of these symptoms are a sign of stroke. Get the person to a hospital quickly. It's important to remember that both TIAs and strokes are emergencies. The longer that treatment is withheld, the more brain cells will die. Knowing the symptoms of stroke is a positive step you can take to avoid the severe damage or death that can result from the condition. Talk to your doctor if you have any concerns about stroke. In America, 1 out of every 16 deaths is caused by a stroke, and up to 80% of those could have been prevented. When anyone can have a stroke, a variety of factors can increase that risk. Some risk factors are uncontrollable, such as your age and gender. After the age of 55, stroke risk doubles for every decade. And additionally, men are more likely than women to suffer from strokes. A family history of stroke means that you have a higher risk of having one yourself. In addition, if you already suffered from a stroke or a transient ischemic attack, that is a reversible loss of neurological function, you have a 40% greater risk of having a stroke within 5 years. Another uncontrollable risk factor is race. African Americans are twice as likely as Caucasians to suffer from strokes, although no one is sure why. Higher rates of hypertension, sickle cell anemia, and diabetes are all possible causes. Atrial fibrillation occurs when the 2 upper chambers of the heart beat irregularly, and often rapidly. This allows blood to pool in the heart, leading to clots. This condition increases the risk of stroke 6-fold, but these clots can break off and be carried to the blood vessels in the brain. Many stroke risk factors, however, are controllable. Having high blood pressure, which is defined as the reading of 140/90 or greater, increases stroke risk 4 to 6-fold. High blood pressure makes the heart pump harder. People with high blood pressure often have constricted arteries that make it harder to move blood through the body. This can lead to weakened blood vessels and eventually to hemorrhagic stroke. Cholesterol is a waxy, fat-like substance in the body that is made internally and is also found in the foods we eat. Some cholesterol is necessary for basic body functioning, but when levels rise above 200 milligrams per deciliter, this can lead to a stroke-causing block. Some cholesterol is necessary for basic body functioning, but when levels rise above 200 milligrams per deciliter, this can lead to a stroke-causing blockage. People who are overweight are also stroke candidates because obesity can lead to hypertension, high cholesterol, and diabetes. Poor lifestyle choices can also increase stroke risk. Because smoking damages blood vessel walls, speeds up the clogging of arteries, and raises blood pressure, smokers have double the risk of stroke. Women who drink more than 1 alcohol beverage a day and men who consume more than 2 also have increased stroke risk. While the stroke risk factors can seem overwhelming, becoming aware of them and taking steps to get healthier can help reduce your risk of a potentially life-threatening stroke. Please see your doctor if you have any of these risk factors for a stroke.
Want to learn more? Check out other videos and sources on this site for more information. United States, but many strokes can be prevented.
A stroke occurs when blood flow to the brain is interrupted. Strokes are frightening, but with preventive measures, up to 80% of them can be thwarted. Some preventative techniques can be as simple as basic lifestyle adjustments. For example, if you smoke, stop. Smokers have twice as much chance of suffering a stroke, and quitting can significantly reduce that risk. Similarly, controlling excess alcohol intake can reduce the likelihood of a stroke. For women, this means keeping consumption down to 1 drink daily, and for men, 2. Doing cardiovascular exercise for a minimum of 30 minutes 5 times a week can reduce your weight and lower your cholesterol, two important factors in stroke prevention. A final important lifestyle adjustment is to eat a healthy, balanced diet. Eat 5 to 6 servings of fruits, vegetables, and grains daily. Enjoy fish at least twice a week. Choose fats and oils with 2 grams or less of saturated fat per serving, and consume no more than 1 teaspoon of salt per day. These guidelines will help to reduce 3 major risk factors that lead to stroke: high blood pressure, high cholesterol, and excess weight. It's also important to know your numbers. If you have blood pressure that is consistently above 120/80, or total cholesterol above 200 milligrams per deciliter, you'll need to work with your doctor to lower them. To get your numbers back to a normal range, your doctor will recommend the lifestyle changes we've discussed, as well as, in some cases, medication. 2 types of medication are particularly helpful in preventing strokes: antiplatelets and anticoagulants. Antiplatelets, like aspirin and Plavix, inhibit the clumping of platelets. Platelet clumping encourages clot formation in the body. It can cause deadly buildups in people with stroke risk. Anticoagulants, like Coumadin, also inhibit the body's ability to form clots, but they do so by interfering with vitamin K. Because vitamin K is essential to creating clotting proteins, this medication can help. Anticoagulants are prescribed for the condition known as atrial fibrillation, which is an irregular heartbeat that causes blood buildup in the heart's chambers. This can lead to clotting and eventually strokes. If you have atrial fibrillation, your risk for a stroke is 6 times greater than a non-sufferer. As a last resort to prevent a stroke, your doctor may perform a surgical procedure called a carotid endarterectomy. During this procedure, fatty deposits are removed from one of the 2 major arteries in the neck, which supply blood to the brain. This can reduce strokes in high-risk candidates by up to 80%. Strokes are life-altering, and they can be deadly, but by taking proper preventative measures, you can reduce your stroke risk significantly.